Reactive medicine is acting after the facts, is hoping, wishing that things will get right, wishing that when you come to work in the morning, there will be enough clients, wishing that clients will want to approve the services you recommend, wishing that your staff will work together, wishing that there will be no big fires to put out. This is reactive. When the phone rings, somebody picks up the phone. A client wants to make an appointment, somebody gives them an appointment. A client comes in and wants a service, somebody gives them the service. Alternatively, if the phone doesn't ring, nothing is done but worrying and hoping it will. When a client is hesitant whether to come in, then giving the client the choice to think about coming in instead of coming in, that's reactive medicine. If the client is in the exam room, service is offered, the client refuses for some reason, then the reactive medicine means we don't do anything. The client goes back into a black hole. There's no follow-up. Nothing happens. Proactive medicine is knowing exactly what the desired outcome is, creating the steps to achieve it, getting into action all the time, every single day, involving every staff member in the action so that every day the practice moves closer to its destination and acting before things happen, reaching out to clients before they come in, creating a system in place so that when clients come in, there is a better way to educate them before a service is provided so they see the value and therefore they approve more services. Huge difference. It is the difference between a practice, a veterinary practice or a veterinary clinic, and a business providing veterinary care. Being proactive in veterinary practice will allow many, many more people to shift from a job to a career. And what a joy it is to be involved in a career where you see things changing, things improving, things growing, achieving your destination. As human beings, we are coded to want to achieve more. We're coded to grow. So being proactive means that we give ourselves the best chances to grow in the direction we have decided ahead of time, along the way collecting the prizes that we do as we grow and having much greater satisfaction in our lives. The first step in becoming proactive in veterinary practice is to decide you want to become proactive, is to decide that the status quo is not sufficient. If the environment changes around you, and it does all the time, if your results are falling behind, and it is a fact in most practices, the number of client transactions dropping, diminishing, this is because most of us practice reactive medicine. If you notice this and if you say there's got to be a better way, I want to find out what that way, and I am willing to learn, I'm willing to change, I'm willing to evolve, this is the first requirement. Sticking to reactive medicine, hunkering down in the face of adversity is not a good way to build a successful business. So first step is wanting to change and accepting the information, accepting the knowledge, and acting upon it. Once this is out of the way, then the next step in becoming proactive is understanding what proactive medicine stands for. So, 4 steps to becoming proactive. First, you need to have a purpose. Second, you need to have a strategy. Third, you need to have an action plan. And then fourth is you need to put things into motion and to never ever stop until you achieve all your goals. Purpose is the first biggest step. Why? Why did we buy a digital X-ray machine? Why do we offer our clients the best service? Why do we answer the phone the way we do? The most important question that clients ask you in the exam room, even though it is in many times not pronounced, the most important question is this really necessary? Whatever you recommend to your clients, this question is always in the air. The client is thinking or voicing this question, is this really necessary? This question comes from a place of, can I trust this veterinarian? Can I trust this staff? Can I trust the recommendation I was given as receiving more value for the cost of the service I'm going to be asked to give. Unless you can answer these questions sufficiently, there's always going to be doubt. And case in point, nationwide, the client compliance in the exam room is only 24%. So only 1 out of 4 clients nationwide says yes to everything. This is not a good way to build business. So how do we answer the question? Yes, this is really necessary by explaining and knowing why. So the nurses and the doctors need to understand why we recommend plan A and not plan B. The receptionists need to know why they handle the phone the way they do. That big why is something that the whole team needs to buy into. So the whole team needs to sit down. You need to agree on what purpose. So one purpose may be we want to grow 20% every year because this is good for us, this is good for patients, this is good for the clients. Why do we do this? Why do we want to grow by 20%? Because it helps everybody. Or another purpose is we want to be known as the best practice to work with in the area, whatever area you are. This is a big why. Why is this important for us? Because by being the best known practice to work in, it will give us the satisfaction of working in a successful practice. And then from that moment on, everything that happens in the practice needs to go along those lines of what is our purpose. This is the best, important, and first step you need to do in order to become proactive. Once this is in place, then that purpose needs to be translated into a strategy. So if your purpose is we want to grow 20% every year because we know that by doing so we will provide better, more care to more patients, and this is why we're here. Now let's translate it into a strategy. So how do we get to the 20%? How do we get known as the best practice in town? How do we get known as a practice if anybody, a pet owner, has an older pet, if they think of you, if this is your purpose, I want to be known as a practice that takes best care of older pets, then how do we achieve it? So you need to create targets for every area of your practice. So it will behoove you to focus on the areas that are more profitable. It will behoove you to focus on areas that are still untapped in our profession. It will behoove you to focus on areas that you and your team enjoy doing and that you see potential to grow into. So, for instance, it is a known fact that nationwide veterinary dentistry generates around 3 to 3.5% of gross production. 3 to 3.5%. The potential of dental care is between 10 to 15 to 20% of gross production. So if you want to turn your purpose into a strategy, then you need to sit down with your team and you need to decide on the various areas. So dentistry being such an untapped area in our practice, let's focus on dentistry. Let's figure out what we need to do to go from 3 to 3.5% to 10, 15, 20%. Why? Because this is where we want to go. This is part of our general purpose. Senior wellness is another hugely untapped area. Junior wellness is another hugely untapped area. Weight problems is another hugely untapped area. Pain control is another hugely untapped area. But first, you need to create a strategy. So you decide for all these various areas available for you, which are the areas that most appeal to you, which are the areas that are most untapped, which are the areas that are going to give you the best results for the time investment. So this is a strategy. How do you strategize? You decide on the areas and then you decide on targets. So you can decide, for instance, dentistry. Let's find out where we are standing at the moment as far as gross production from dentistry. 3.5% nationwide. What is our target? 10%. Very well. Next area, senior wellness. How much are we generating right at the moment from senior wellness? What is the potential? We know that between 35 to 40% of all patients are 7 years and older. At the moment, senior wellness generates maybe 1% of our gross production. Great discrepancy, huge potential. Let's set the target for how much we want to generate from senior wellness, etc., etc. So you need to create all the key areas in your practice. You need to create a plan for them for you to get there. So dentistry. How do we get from 3.5% to 10% to 15%? Step number one, we need to do more dental services. Strategy two is we need to do better dentistry. Because if we provide better dental care, we can charge more. So, for instance, in dentistry, a really good opportunity is to start taking dental radiographs. If you are taking dental radiographs, then you need to start strategizing to charge better and to learn how to read dental x-rays better, and then to learn how to deal with the diseases that you will find with better dental radiography. Senior wellness. What are the specific breeds and how are they reacting? What are their issues as they grow older? So because the more specific our approach to senior wellness, the better the response. This is how it works. So instead of just hoping that somebody will want to do a blood test on a senior pet, we create a strategy to achieving specific growth from senior wellness. So we say we're going to go from 1% to 10% of gross production, or at least 15% because senior wellness is such an important part of our practice. We create a strategy. The next step is to get into action. So once we decide that we want to go from 3.5% in dentistry to 10% to 15%, then we say right now, 3.5% we do 10, 15 dental cases a month. What will it take for us to get to 10%? Do we need to go from 10 dentals to maybe 25, 30? Easily done. Right now, how much are we grossing from dentistry? Maybe 300, 250 at the most. For us to be able to get to 10% of gross production, dentistry needs to go to $500 or $450. What does that mean? We need to provide better care. What is still missing? We don't have a dental x-ray machine. Or we have an antiquated dental x-ray machine. Let's replace it. Let's make the investment. It's going to be paid off quickly. Let's learn how to take x-rays. What do we need to do in order to take better x-rays? We need to learn who is going to teach us. Let's organize it. Let's arrange it. Let's have it done. Then we need to learn how to read x-rays. Who is going to help us? Let's create an action plan to find out how to learn how to read x-rays. Let's learn then how to deal with the more advanced cases when we find them. And 40% of the time you will find them. So who is going to teach us how to do this? Let's find out. Let's create an action plan to find out who is going to teach us. Let's get into action for every single area. Let's learn how many calls that come in turn into appointment. No idea. Then how can you become proactive answering the phone? Let's start measuring how many calls we get every day. Let's measure how many of them turn into appointment. Let's create a target. Right now we maybe have 3 out of 10 who turn into appointment. How about we want to get to 6 to 8, 9? What is it going to take? Well, we need to have people who know how to answer the phone. We need to train them. What does it take to train them, etc., etc. You need to create specific plan and action plan for every single function in your practice. Yes, one may say it takes time, it's a lot of effort, but look at the huge difference between being reactive and being proactive in your practice. And the good thing about this is that you only have to do it once. Once you create it well, you can use it and use it and use it for years and years to come, and you will achieve most or all of your goals in practice and in life. Now, a big part of the action plan is once you create the ultimate target, so going from 3.5% to 10%, for instance, in dentistry, then you need to set some rewards along the way. Rewards really motivate people to want to excel. So if we get from 3.5% to 4% to 5%, you're going to get this. What do you want to get from going to 3.5% to 5%? What do you want to get from going to 5% to 9%? How are we going to celebrate once we get to 10%? Once we get to 10%, where are we going to go next? And what are we going to receive when we go from 10% to 15% of gross production from dental care, etc., etc.? Rewards are really, really crucial. That's the action plan. Now, in order for you to be able to become proactive, in order for you to be able to turn your action plan into actually doing things, is you need to understand some rules about business in general and veterinary practice. First, it is a lot better when you start a new service to have a special focus. We all know that February is National Pet Dental Month. So it's been going on for years, and as a result, both veterinary teams and veterinary clients know that come February, there's going to be more talk, more chatter, more intention and attention to dental care, so we do more dental. It is very common for most practices to do more dental care in February. Why? There's nothing magical about February, just special focus. So whenever you start a new area, be this ultrasound, be this senior wellness, be this dentistry, be this weight management, be this pain control, whatever you want to focus on, whatever you want to grow, you create a special focus. So if it is August today or if it is September today, the next month is our special month. October, December, November, doesn't matter what the month is. This month is our special focus month on weight management. November is our special month on pain control. What does that mean? Is the whole team gets together. We all focus on November, making November a very successful month for taking care of pain problems in our patients. We reach out to our clients, we educate them beforehand. We have something on a website that talks about pain and how much pets suffer from pain without talking about it, without letting their masters know they're suffering. We educate clients and we say, in November, we have a special focus, we do this and do that. So that special focus will get the buzz in the practice, will get the buzz among your client, and will put them into greater action. Now, if November turns out to be a very successful month when it comes to pain control, then you may want to extend it to December, or you may want to do it again the following year. And so every month or every 2 months, you have a special focus. It really works very, very well, and it will help you become proactive. The second component of helping you to get into action and achieve your results is to realize that not all of your clients are the same and not all of your actions are the same. The Pareto rule, which was discovered in the 19th century, says that there is a small group of actions generate a large group of results. A small group of clients give you a large portion of your revenue. Some say it is 30 to 70, some say it's 20 to 80, it doesn't matter. A small group of actions will generate a large group of results. Following the Pareto rule, you should identify who are the top 20% of your clients who generate 80% of your revenue. It's always like this. It's amazing how powerful this law is. All you have to do is identify it. So I suggest sitting down with your team and reviewing all the things to do in the practice. It can be about dentistry, it can be about senior wellness, it can be about anything you want. And then you decide what are the top 20% actions we are doing that generate the results. Let's find out what they are. Let's do them all. Let's get rid of the big chunk of the remaining 80% of the actions, because we know that those 20% of the actions are giving us 80% of the results. Why is this important? Because when you focus more of your time, more of your intention on the actions that give you the better results, you will receive better results. Now, the next part is picking and choosing, because not all your clients are the same. If you want to focus on dental care, not all of your clients are likely to want dental care. If you focus on weight management, not all of your clients have pets with weight problems. You need to identify them. If you segment your client base, not all of your clients have senior pets. If you send information to clients with young pets, it's not going to generate the results you want. So what you need to do is you need to pick and choose. You need to find the clients who are more likely to say dental care. You need to set up the parameters of how to find them. You need to set up the parameters of how to find all the clients who have senior pets. And then you need to, among that group, you need to find out what are the different groups. You can separate them by weight, because we know that large breed dogs have different needs when they're older than small breed dogs. And we also know that large breed dogs become older at a younger age than small breed dogs. Once you identify what each client group needs, now you can create specific messages for them. Now you're going to have a much, much greater response. And the last part of getting into action is measuring where you're going. You're never going to be able to reach to your destination without you being able to measure where you're going all the way. If you've ever been on an airplane, the pilots have a variety of machinery in their airplane to be able to tell them where their airplane is going. If the airplane goes from point A to point B, and then the airplane is buffeted by wind or other atmospheric changes, and it moves away from its destination, there's an immediate feedback mechanism in the airplane that identifies it and brings it back to its destination. Otherwise, you will not end up where you want to go. Same thing with your practice. If you want to go from 3.5% in dentistry to 10, 15 in 6 months, you cannot wait 6 months to measure it because you're not going to be there. You're going to be somewhere completely different. Instead, you need to set up targets and benchmarks along the way. So if you want to go from 3.5 to 15% in 6 months, then you need to ask yourself, then where do we need to be in 3 months for us to be able to get to where we want in 6 months? Where do we want to be in 2 months for us to be able to get to where we want to be in 3 months, etc., etc.? Where do we need to be in 1 month? How many dentals we need to have in 1 month? Every month. How many dentals we need to have every week? How many dentals do we need to have every day? How many clients do we need to talk about dentistry to get to however many dental cases we want in a month? That needs to be measured. Those benchmarks are not achieved, then you know you're not going to get to your destination. But when this happens, you stop and you say, we have not achieved our benchmark. We are at the danger of not achieving our ultimate goal. Let's sit down. Let's try something else. And let's figure out what we need to do. And you try and you try and you try until you get it right. And once you get it right, you use it all the time. It's that plain. Now, the last step is once you agree on everything, is to put everything into motion. So what does that mean? You attach every action to a person. You don't just say somebody's got to do it, because when you say somebody's got to do it, nobody does it. Instead, you assign tasks to people. You come to an agreement with people and you say, do you understand what we are asking you to do? These are the tasks you need to do. Do you understand how often you need to do this? Once a day, once every week, whatever you decide. Do you know exactly what we're talking about? Let's train. Let's provide you with education so you know what you're doing. After I've trained you, now you show me how you do it so I know that you understand. Very well, you've showed me. Now we all agree that you understand what it is. You know what the expectation. You also know why we do this. And now you're going to do this. Now you need to hold them accountable. So if Susie doesn't do what she's supposed to do, then other people are not going to do what they're supposed to do, and everything is going to stop, and you're going to become reactive again. Instead, if Susie doesn't do what she's supposed to do, somebody needs to notice this. Then somebody needs to sit down with Susie and needs to clarify with her what happened. Maybe something happened. Let's get over it. Let's give Susie some help. Or maybe Susie's not the right person to do these actions. But don't forget, going back to rewards. If Susie doesn't do what she's supposed to, everybody else is doing, when it is time to giving rewards, then Susie or David may be left aside. So they realize that there are consequences. In other words, you hold everybody accountable for their productivity, not their activity. And that's how you become proactive.